You found the podcast Go Beyond the Brief, where we take a deep dive into the societal currents shaping our lives. Together, we'll explore the often unseen forces at play. We'll examine the research, dissect the data, and most importantly, if you're seeking to understand what's shaping our society, this is the place.
Into a really significant development. It's reshaping the whole landscape of U.S. healthcare policy for 2026.
That's right. Our sources, well, they paint a fascinating picture, sometimes conflicting, actually, about what's happening at the highest levels of public health.
And how it impacts you directly.
Exactly. We're sifting through, reports, analyses, official statements, all digging into this new Make America Healthy Again, or MAA initiative.
Right, MAHA.
Our mission today, to pull out the key insights, help you understand the different angles and, well, what it all means for American health down the road.
We'll be talking about a credibility crisis at the CDC, big shifts in vaccine policy.
Yeah, and even how these changes are hitting, individuals and communities on the ground.
So if you're looking for a way to get up to speed on this fast-moving situation, with some surprising facts, clear explanations, you're definitely in the right place.
Absolutely.
Okay, let's unpack this.
Let's do it.
So right off the bat, our sources point to this, profound crisis at the CDC. It starts with the director, Susan Monterez, leaving very suddenly.
Yeah, dramatic departure is the word. Her tenure was incredibly short, like less than a month after her Senate confirmation, which was August 27th, 2025.
What does that signal? I mean, that fast?
It signals a deep, immediate clash. The White House publicly said Monterez was, quote, not aligned with the president's agenda. Simple as that, from their side.
But that wasn't the whole story, was it?
Not at all. Her legal team pushed back immediately. They asserted she was fired for refusing to rubber stamp unscientific, reckless directives and fire dedicated health experts.
Strong words.
Very strong. And they're challenging the dismissal legally. They argue only the president who nominated her can fire her. There's actually a 2023 law involved designed to give the CDC director more independence.
Ah, okay. So it's not just politics, it's a legal fight, too.
Exactly. A legal standoff.
And it wasn't just her. This seemed to trigger more departures.
Oh, yeah, like dominoes. A cascade of resignations from other senior officials right after Monterez.
Like who?
Well, Dr. Deborah Howery, the deputy director. Dr. Dimitri Daskalakis, he headed up the Immunization and Respiratory Diseases Center.
NCRD.
Yeah, NCRD. Then Dr. Daniel Jernigan, Dr. Jennifer Layden. Top people.
And they weren't quiet about why they left.
No, many went public, describing it as a weaponization of public health. Dr. Daskalakis, for instance, he explicitly called out political interference, data manipulation.
Data manipulation.
Yep, and what he termed a decline in scientific integrity. He even voiced fears about harm to kids from poor vaccine decisions he saw coming.
Were there specific examples given?
Some officials pointed directly to things like the removal of a CDC analysis about thimerosal, the vaccine preservative.
Oh, right.
That analysis was apparently pulled from the CDC website at the direction of HHS. So, when career scientists leave like that publicly, it sends a pretty clear signal.
And the public reaction, especially there in Atlanta, near the CDC campus.
It mirrored that division, yeah. Reports of hundreds of supporters applauding the officials as they left, chanting, USA, not RFK. It really highlights the charged atmosphere.
Okay, but what's the other side? The administration's view on this? They can't see it as a crisis, surely.
Well, no. From their perspective, or at least how some sources frame it, Monterez's ousting and the resignations weren't a crisis. They were necessary and decisive steps.
Necessary for what?
To align the CDC's leadership with the new MAHA priorities. It's framed as crucial for ensuring the CDC focuses on this new strategic vision, shifting from mainly infectious disease to the chronic disease epidemic.
Okay, so after all that, who steps in?
Jim O'Neill. He was appointed acting CDC director, and his background is different. Former investment executive, finance, humanities.
Not medicine or public health?
No.
Okay.
Which is a really significant shift from, basically every past CDC director.
How big a deal is that, having someone without that specific background leading the CDC?
It's huge. It fundamentally redefines the leadership role there. Some see it as a tactical move, a strategic masterstroke, one source called it.
Why a masterstroke?
To get around the Senate confirmation process for a permanent director, That process is meant to insulate the job from political pressure, right?
Right.
So the argument goes, his background brings needed business sense, strategic thinking to a bureaucracy. His role is reframed, strategic leader, rebuilding trust.
So less scientist-in-chief, more CEO.
Kind of. The core insight here is that we're seeing this rapid fundamental shift in what a public health agency is supposed to be, from, an independent science body to one more directly tied to political goals. It changes everything about how policy gets made and how people see it.
Okay, so that's the CDC leadership turmoil.
Mm-hmm.
But you mentioned broader changes involving vaccine guidance.
Yeah, moving beyond the CDC's internal drama, there's an even bigger shakeup in how the nation handles immunization guidance. And this is where it gets really interesting. Back in June 2025, Secretary Kennedy made a really dramatic move, fired the entire advisory committee on immunization practices, all 17 members.
The whole ACIP. Wow, they're the ones who make the vaccine recommendations, right?
Exactly. Historically, they're this independent panel. Evidence-based recommendations, transparent process, peer-reviewed. That's been the bedrock.
So why fire them all? What was the justification?
Kennedy's stated reason was to restore public trust and deal with perceived conflicts of interest. That was the official line.
How'd that go over?
Not well with many professional groups. The American Nurses Association, for example, condemned it strongly, called it a subversion of scientific consensus.
Okay, so the old ECIP is out. What about the new one? Who's on it?
Well, the new panel is quite different. Our sources describe it as having members who, according to critics, have limited immunology expertise, or are known critics of mainstream vaccine science.
Can you give an example?
Sure. There's a biostatistician who co-authored the controversial Great Barrington Declaration, and a psychiatrist with apparently no background in vaccine research.
But how does the administration frame this new committee?
From the MAHA perspective, this clean sweep is presented as, again, decisive and necessary, restoring integrity, moving away from a committee they saw as a rubber stamp for industry.
So they believe this new hand-picked group, as they call it, will be better.
Yeah, they argue it ensures recommendations are insulated from conflicts of interest and based on unbiased science, an essential step, in their view, to rebuild public trust.
So this overhaul wasn't just symbolic. It led to actual policy changes.
Oh, absolutely, concrete changes. For the 2025-2026 season, the FDA limited its approval for COVID-19 vaccines. Only adults 65 and older and those with underlying conditions.
That's a big change from before.
Huge. And the pediatric COVID vaccine for kids under 5, removed from the market entirely. Remember, previous guidance recommended shots for basically everyone 6 months and older?
Right, so what's the practical impact for just, regular people?
That's the crucial question. These new eligibility rules mean healthy Americans under 65 face real hurdles now.
Like what?
You might need a doctor's prescription. There's uncertainty about insurance covering it. And in at least 19 states, pharmacists actually can't legally give vaccines unless they're explicitly on the CDC's recommended list.
So even if a vaccine is approved by the FDA, you might not be able to easily get it at a pharmacy.
Exactly. As one expert put it, available with barriers isn't accessible. It creates this fragmented, confusing situation for people.
It really sounds like a patchwork public health system is emerging. You mentioned states like California, Oregon, Washington doing their own thing.
Precisely. They're coordinating their own vaccine guidance. New organizations are even trying to replicate the kind of data work the CDC used to do centrally. That fragmentation is a key takeaway.
But the MAHA viewpoint sees this differently.
Completely differently. They frame these changes as a strategic shift. A risk-based vaccine strategy, they call it, aligning with how some other countries do it, emphasizing science, safety, and common sense.
And the confusion, the friction, as they call it.
They see that as necessary, temporary, designed to push states, medical groups, private companies to develop their own strong science-based protocols.
So decentralization is the goal.
Yeah, fostering a more durable, transparent, and decentralized system. It's a fundamental shift in how public health is supposed to work in the U.S.
Okay, let's zoom out. What's the big picture here? This Make America Healthy Again, MAHA agenda. What are its stated goals?
Publicly, it's presented as this bold plan to tackle chronic disease, focusing on things that sound pretty popular, right? Like nutrition education in medical schools, reducing environmental contaminants.
Things most people would support.
Exactly. Even launching an investigation into the causes of autism. Populist-friendly goals.
And how is that agenda viewed?
Well, from one angle, it's praised. Seen as a rational, urgent response to a healthcare crisis. shifting from just treating symptoms to confronting root causes.
The focus on kids.
Explicitly prioritizes the childhood chronic disease crisis, with actionable steps like phasing out petroleum-based food dyes, overhauling the GRAS standard for food additives, generally recognized as safe, and expanding safe infant formula options. It's pitched as a return to neglected public health basics, a more holistic view.
That's one side, but I'm guessing there's a critical take too, especially given the CDC turmoil we discussed.
Oh, absolutely. Critics argue MAA is more like a strategic trope, a nice-sounding veneer of common-sense goals.
A veneer for what?
To deflect from more controversial actions. They point out the contradictions.
Right.
Like championing public health while overseeing budget cuts and staff reductions at places like the CDC.
Yeah.
Or claiming to embrace science while firing the entire ACIP and bringing in vaccine skeptics. That undermines the established scientific process.
The administration also talks a lot about radical transparency. How does that fit in?
Well, one analysis suggests that transparency is used strategically, used to relitigate scientific questions that were considered settled, like the autism causes issue.
Why do that?
To cultivate a narrative that the established systems are corrupt or broken, which then makes the administration's fresh thinking look like the only trustworthy option.
So undermining trust in existing institutions is actually part of the plan, according to critics.
That's the argument, that the erosion of trust is a feature, not a bug, serving a broader cultural and political agenda, maybe beyond just public health.
Any evidence for that broader agenda?
Well, critics point to things like a lawsuit settlement where the administration had to restore health websites it took down, and HHS explicitly mentioned removing radical gender and DEI ideology as part of its commitment. That suggests wider cultural goals are intertwined.
It's definitely complex. The framing, the narrative, seems just as important as the policies themselves.
Absolutely. Presenting reforms as rebuilding trust, even while critics say the actions do the opposite.
Okay, let's pivot slightly. There's a key figure sort of caught in the crossfire here. Senator Bill Cassidy, Republican physician from Louisiana.
Yes. His situation really highlights the tensions we're talking about. His support was actually crucial for Secretary Kennedy's confirmation.
Even though Cassidy himself had concerns.
Big concerns. He publicly stated, during Kennedy's confirmation hearing, directed right at the nominee, "Your past undermining confidence in vaccines with unfounded or misleading arguments concerns me."
But he voted to confirm anyway.
He did. After getting what he called serious commitments from the administration, it shows him trying to navigate this politically tricky spot while flagging a major public health worry.
Did those commitments hold up, in his view?
Well, after the CDC turmoil, he definitely ramped up his concerns again, talked openly about serious allegations that children's health might be in danger. He's called for congressional oversight.
But his statements sound careful.
Very cautious. A political balancing act. He's clearly framing his questions carefully.
And why is that? What's the political calculation for him?
It's all about survival. He's up for re-election in 2026. Louisiana is a state Trump won easily, like 60% in 2024.
And Cassidy's relationship with Trump isn't great.
It's described as cool. Remember, Cassidy voted to convict Trump in the second impeachment trial.
Ah, right. So he needs the base, but...
Exactly. His political future depends on appeasing a party base that's often deeply skeptical of the very institutions, like the CDC or scientific consensus, that his medical background tells him are important.
It sounds like a real bind.
A total bind. One Louisiana Republican commentator basically said Cassidy has to vote Trump's way to stop Trump from actively campaigning against him. It leaves him, quote, with no wins.
So his situation is maybe bigger than just him.
Yeah, it exemplifies this broader trend, the tough spot for traditional institutionalists in politics today, where your professional identity, rooted in science or medicine in his case, clashes with partisan demands that might reject scientific consensus. It really shows how political survival instincts constrain the checks and balances we rely on.
Okay, so while all this is happening at the federal level, the turmoil, the policy shifts, real life goes on. There was a public health crisis in New York City.
Yes, in late July. A deadly Legionnaire's disease outbreak.
Where exactly?
Central Harlem. It resulted in 114 confirmed cases and, sadly, 7 deaths. They traced it back to cooling towers on top of city-run buildings.
How was the response?
New York City's public health officials jumped on it quickly. Testing, mandatory cleanup of the towers, public messaging. It showed effective local public health in action.
Now, our sources are clear, right? There's no direct link between the federal chaos and this specific outbreak.
Correct. No direct causal link established, but the sources say the two events are inextricably linked in public discourse.
How so?
News headlines started framing them together, asking questions about how public health is being managed overall during this time of federal upheaval.
So it creates uncertainty.
The perfect storm of public uncertainty, yeah.
Ah,
When the federal government's actions are being described as eroding core work and leaving states without clear guidance.
then it's harder to trust any public health message.
Exactly. Whether it's coming from federal or local sources, the public is already primed for skepticism, maybe more likely to believe local critics, even when local officials are doing a good job, like in NYC.
But interestingly, the MAHA perspective sees this kind of state-level action, like NYC's response, as a good thing.
Almost like a validation, yeah. Evidence of a healthy, decentralized system where states are empowered or maybe forced to step up and adopt policies that work for their own people.
So the effective local response proves the federal system isn't the only way.
That's the argument from that viewpoint, that this fragmentation isn't a failure, but a positive shift towards federalism. It encourages state innovation, builds local resilience. The idea is the federal vacuum forces states to get stronger.
It really highlights that deep ideological divide over what an effective public health system even looks like.
Profoundly. Centralized expertise versus decentralized resilience.
Wow. This has been an incredibly insightful deep dive. We've covered a lot.
We certainly have.
It's clear we're in a really pivotal moment. You've got the CDC credibility crisis, these huge shifts in vaccine policy, the rollout of MAHA, and these completely contrasting ways of viewing it all.
Absolutely. What this really reveals, I think, is this clash of basic philosophies. Is public health purely science, or is it inherently political? Or maybe both.
And the consequences are real.
Yeah, the CDC turmoil, the fragmented authorities, Senator Cassidy's tightrope walk, it's creating a new normal.
Yeah.
Scientific consensus isn't the automatic starting point for policy anymore.
Which could lead to
A potentially weaker public health infrastructure, maybe. A public left confused by conflicting guidance, possibly making the country more vulnerable down the line.
But we also laid out the counter-narrative, that this is a necessary overhaul, strategic, building a more resilient, prevention-focused system, empowering states, empowering individuals through transparency.
Right. A return to core principles as they see it.
So it really leaves a critical question for you, the listener.
Yeah. In an era with so much information, but where trust in institutions is, let's say, shaky, how do you figure out what to believe?
And maybe more personally, how might these huge shifts ultimately empower you or maybe complicate your own health decisions and your ability to get care?
Something to definitely chew on as these policies continue to unfold.
Indeed.